Marc Zeinoun. I prefer to speak in English, given the technical terminology. However, I'm in and out in Armenian. So first of all, thank you, Vicken, for the invitation. Two words, and also I promise to be the German way in time. So first of all, Rheinland is a German company, TUV, established 1872 in Cologne, Germany. You have TUV in each of your hospitals, clinics, labs, or offices also, because TUV certifies, tests medical devices, starting from Siemens Healthcare to GE Healthcare, and all the medical equipment that you use in your labs and diagnostic services, going to also the office printers, into the most everyday car that you use if you're using German cars, to ensure safety and quality. I will stick in my presentation to the healthcare part. So in Armenia, when we began our operations in 2010, we had four main points to focus on. First, inconsistency of quality standards between healthcare facilities, especially that there's no national level regulatories and follow-ups done. Therefore, we put one of our objectives to tackle patient care. Trust and transparency. I come from actually Lebanon, where we adopt the French hospital accreditation system, where we have third-party accredited or recognized bodies to audit hospitals to be licensed. Okay, so no license without accreditation, without quality standard implementation and infrastructural implementation, and therefore, and this is the interesting part, is the link between the social security compensation and the level of maturity of the quality management system. Just an example, if you have in Lebanon A+ in your accreditation results, you can invoice MRI to the government to $50. But if you are at the B level, meaning you don't implement all the standard, you cannot invoice it more than $150. Okay? So this creates a national competition to improve the infrastructure and meet the accreditation result so that they can have also economic interest. Third, market access barriers. Those tackles the medical devices manufacturers. So we also diagnose that to be able to certify the national Armenian manufacturers based on CE requirements to be able to export to Europe. And the last one is the regulatory alignment with the EU, with the US requirements. Quickly, our healthcare solutions, starting from the labs, the manufacturing practices, good manufacturing practices, good lab practices, good distribution practices, and also for the packaging 15378. I will focus also in the healthcare organizations, hospitals, for the ISO 9001 certifications. We did a lot in JCI. You already know that three of the key players in the healthcare sectors are already accredited by the JCI. We had a lot of work in implementing the requirements, as well as in auditing before the JCI gets in to make the accreditation. Also, other standards related to the lab. Medical devices, MDR, IVDR is the big title now in Europe. No medical device can enter Europe without being certified and tested against the medical device regulations and the in vitro diagnostic devices regulation that we do on daily basis, with sometimes a queue up to 6 months even to elaborate, because the logo and the certificate of TUV is a passport to the international market. Last, just in a couple of seconds, the results of the work. One, the JCI and the ISO implemented in hospitals. With that standard, we reached a very improved level of medication errors reporting in the hospitals where we work. A lot of improvement in surgical safety and the reporting of complications, as well as reporting of morbidity and mortality rates to generate a certain level of analysis. Medical tourism, also, it was the result. Actually, the medical tourism is a complete chain. We tackled only one part, and we have a lot of things to do on the other parts of medical tourism. Also, implementing the international practices for pain assessment, fall assessment, suicide assessment, which is in the way to align them with the international best practices and ensure patient safety in the first place. Last, also, we had several cases, just one case that I'm mentioning here in Armenia, for a producer of aids, walking aids, that exports to Europe. We provided them with all the required certifications to be able to sell, and the company is now selling in Europe their product, which is manufactured in Armenia, not assembled in Armenia, it is manufactured in Armenia. So, that's all. Thank you very much. And